Perfect. On the participant list, feel free to just give me a thumbs up if you were unable to get through the materials for class prep. I just want to, know if you haven't had a chance to look at it. No point in me calling on you. So it looks like everybody was able to get through the materials. The YouTube was very short, and at 1.5 times, it was like a 5 or 6 minute total. Thought it was pretty good on global warming. Why don't we just start by going around and basically just remind everybody of your topic and your update. And the second thing to do is, a Kaiser Health News topic of interest. And I don't know what's the easiest way to do this. Let's just start today. We'll do reverse alphabetical, just so we mix it up a little bit. Megan Wilson. Megan.
Hi. So I'm doing my paper on postpartum psychosis. And I'm sure most of you know, like a couple weeks ago, a woman from Massachusetts is being tested to see if she does have postpartum psychosis because she killed I believe 3 of her children. So they're trying to figure out if it was caused by postpartum psychosis or not. So that's definitely one case that I'll be talking about in my paper. And then for the Kaiser News and everything, I found an article talking about how Ohio crews conduct a controlled release of toxic chemicals from derailed train cars, which is also called like a controlled explosion due to all the toxic chemicals found on the cars.
I think that was just done in an effort to prevent a massive explosion and shrapnel being sent out, over a mile. And I think, you have to contain the damage and the harm to human beings. So, I mean, and frankly, toxins were going to be released if it combusted, maybe less toxin than, because once it's combusted, typically there's less of the natural elements because there's been combustion, it's burned, and there's a chemical reaction. But I'm sure they did the cost benefit analysis and said for safety and protection of property, the best thing to do is to just do that. So I didn't realize they had done a controlled release. I had missed that one. So interesting. Sydney.
So my topic is just like physician assisted suicide. So I've been looking at a couple different things on that. I just found one on like Oregon, who they made it legal in 1997, I think.
One
So
of the
then,
first states, yeah.
yeah, so then they just like released information about it like after to kind of like the public to see like if other states would want to do the same thing. So I was looking into that. And then for the Kaiser Health, I saw I think it was this morning actually, one of the FDA is asking that people like report their positive COVID tests because, and I was thinking about that because like the numbers are all so skewed because now we don't report it, like you don't have to tell the government, like things like that when it first started. So now it like looks like the numbers are going down, but like when everyone had it over winter break, like nobody told anyone, like everyone just self-quarantined, self-tested.
So yeah, I read that with great interest as well. So as a public policy issue, how effective do you think self-reporting is going to be?
It's not, people aren't going to do it because they're going to be like, oh, they're going to trace me down and track me.
Privacy issues, a lot of stuff. The other thing about self-reporting, what percentage of people are asymptomatic who get the disease?
A lot.
Yeah, a ton. So what does that tell you? Not much. I mean, the data is all over the place on COVID. You'd think we would have our hands wrapped around this. It's all over the place. So what other ways can you figure out? What are the best ways to figure out whether the disease and the significance of the disease is when you're doing public health sort of oversight?
Well, I guess like not that
This is
they
for
don't
everybody too.
matter.
This isn't, I don't want to pick on you, but
Oh, well, I was thinking more of like not that they don't matter, but like the ones that are asymptomatic or even have like symptoms that aren't very severe, like don't come into the hospital and things like that. So not counting them as patients who are like, you know what I mean? Does that make
Yeah,
sense?
no, though, I think that's spot on. I've always been a much bigger fan of measuring hospitalizations. Now, what that doesn't give you is the denominator of how many people were infected and how much it's spreading, because we have so many that are asymptomatic. But what is the ultimate decision maker of how significant the infection is? The ultimate denominator is if you're hospitalized or you die or you end up with permanent disability, and those people get into the healthcare system. So, let's just say we had a flu season where everybody, it was an incredibly transmissible variant of the flu. Nobody got, nobody got, vaccinated for it. Would that be a bad thing or a good thing if we had something like that? And, the answer is, who knows? I mean, the reality is, if only 5 people die that year, and typically it's somewhere between 30 to 60,000, and very few are hospitalized, then it's kind of a disease without any significance. So you have to sort of figure out, step back and say, hey, what do we really care about? We care about hospitalizations, morbidity, and mortality. And if people are not dying and there's no morbidity associated with it, then hey, consider that a hugely successful flu season, in spite of the fact that it's incredibly transmissible and everybody got the disease. So, and over the course of COVID, obviously the morbidity and mortality, even with the variants, has pretty dramatically decreased, so that it's only slightly above influenza in terms of its, rate of hospitalization and deaths. And again, massively disproportionately affecting the vulnerable, so the elderly and people with underlying conditions. So yeah, that's good stuff. Yeah, how many states? I think it's 15 or 17, but I forgot to Google it. Have assisted suicide.
It's very few now because you have to find 2 physicians who are willing to work with each other, who are both willing to sign off on it. There's a grace period from when you ask for it that they make you wait in case you change your mind. And you have to go through all these technicalities to actually have it done. They can't just pull the plug on you like that. If you have a life that you can still live, it might not be a good quality of life, but if you can still live, they don't want to do that. If you lose your leg and you're like, I want this, then they're gonna make you wait. They're gonna make you go and do sessions and all that stuff.
So it's highly specific. Every state has their own requirements and prerequisites. Some require that a physician certify that you'll be dead in 6 months, or that you have a lethal disease. One of the jokes about having a lethal disease is being alive is a lethal disease. We all know that at some point our time will come. So, somebody may have, let's say, cancer, and they're allowed to, but they may have horrible COPD, which has an even worse prognosis than emphysema. If I use acronyms that you don't know, it's only because I've been using them for a lifetime, but you guys almost all have medical background. But anyway, emphysema, which has or end-stage congestive heart failure, which has a much worse prognosis than many cancers. So there's a lot of sort of semantics of whether it's one doctor or 2 doctors, or whether you have to be certified by a psychiatrist as not being depressed or anything. So I just did a quick Google of this, and you guys please do that in the future. It looks like there's about 10. So Oregon, Washington, Montana, Vermont, California, Colorado, Washington, D.C., Hawaii, New Jersey, Maine, New Mexico. I don't know if that adds up to 10, but that's the compassionate choices. So that's one of the groups that advocate. So it's around, people can shop to go to a state they want, and which is unfortunate, that you have to leave the state to be able to get your wishes honored. But each state has its own little vagaries as to what's required. And overwhelmingly, I'd say way over 50% of physicians are more than happy to help patients fulfill their wishes. So that's kind of a good thing, that patients can not be dragged on. Olivia.
Sorry.
No worries. Oh, sorry, I didn't mean to get you your mouth full. I
No,
got
you're
at you. Okay.
So for my project, I'm doing prevention and early intervention in autism. And I was looking at specific genes earlier, and I guess they haven't identified like a specific like single gene that is like what causes autism, but there must be some sort of like genetic component to it because they have found links between like relatives and everything. So they're thinking it's an interaction between multiple different genes, but they haven't been able to specifically identify them yet. But I mean, I thought it was really cool. Like we have a family at the school that I substitute for, and they have 5 children, and all of them have an autism diagnosis. So there has to be some genetic component to it. But
So it's interesting in terms of your screening, you know, do you do both? Do you do behavioral screening or genetic screening or biologic screening or both? So you'll educate us all as to what the current research is. I will tell you that the whole field of genomics is not quite ready for prime time. It's advancing massively and quickly, but almost everything is polygenic. It's risk factors. There's very, very, very few diseases where it's just one factor. And as we know, and if you're familiar with it, the environome and your microbiome, and there's so many other factors beyond your genetic code. In addition to the environome being your zip code, we've talked about that. So that's kind of cool. Anything in the news that you're
so this
interested?
morning I was reading the link from this morning about they have a secret weapon for the next pandemic, which is really just in Bozeman, they're doing research on Jamaican fruit bats
I
because
read that as well this morning.
bats are one of the most common vectors for zoonotic diseases, and because like COVID, we have zoonotic like links to it. So I thought that was really interesting to try and
Is it fruit bats? It's banana bats. It's fruit bats. It's some kind of weird bat.
yeah, it's a fruit bat.
Fruit bat. Yeah, I thought that was
Jamaican
weird.
fruit bats.
Oh, there you go. So interesting. Yeah. You know, anything that we can get a head start on it. I mean, I still think the current thinking is that the market, those open wild markets that, and it's not the first time we've heard that as being a potential source for a lot of diseases that end up being pandemics. So anything that can give us a heads up on it. So yeah, I thought that was interesting as well. Jack, your topic, where you stand with it, and your anything in the news.
In the news this morning, I looked at the holdout on the distracted driving laws.
Oh,
that was
scary.
kind of, yeah. I don't quite understand that with where we're at nowadays, but I thought that was interesting to see. And then for my topic, I was just looking into, I'm still looking in SAMHSA. They got just a crazy amount of different intervention and prevention programs. So
is there any research being done on it, or are you going to interview people? I just know nothing about the topic. Very interesting, but I'm not familiar with it. Are you going to interview specific departments, or is there anybody studying them? Which ones are effective or not effective?
Well, they kind of break it down in different categories, like depending on like what happened. Like they have disaster, like intervention for afterwards, like prevention. They have screening processes. They got like
it would be interesting to compare some of the screening processes or different interventions, or whether they should be specific to the facts of this situation or more generic, just because it's such a huge problem anyway. So yeah. Okay, so that's great. I was going to say Amanda. Of course, she's not in the class, but she made it on my first class list. Kylie.
I had the same Kaiser's news topic as Olivia. I like the bat thingy. I thought it was interesting.
Yeah, it was cool.
And then for my paper, I'm still looking at mechanisms to fund children's health insurance. And then like my fun fact from that was that the CHIP program's only funded till 2027. they won't permanently fund it yet, and I'm like trying to figure out why. That's
Yeah.
really it.
Yeah, no, scary stuff. And what percentage of children, it's a scary number, rely on CHIP and social programs to get their health care? Like
I don't know the
10%,
number yet.
20, well, yeah, we'll do a survey of the group, 10%, 20%, 30%, 40%, 50%. Yeah, you guys are really good. I mean, you know, they say that 10 to 12% of the population is uninsured. So I would have guessed, if somebody said and I didn't know, that it's, you know, it's got to be 15, 20%. It's actually crazy high. It's closer to 50%. So it just shows an even bigger and more tragic gap. The only consolation is that you know, kids are generally healthy. A lot of it is just preventative care. But, you know, still, it's just tragic that you can't get your, you know, that 50% of kids are going in using either Medicaid or CHIP or some other program to get taken care of. So cool. Jennifer.
So for my paper, I'm doing surgical safety with neurosurgery. And what I did research on this week was like the general surgical safety checklist that every hospital needs to go through when they go through a surgical procedure, which I thought was really interesting. Just understanding the breakdown, because I didn't know how much. I knew it went into a lot of detail, but the detail that they like do go into is very extensive, and how everyone in the team, from the surgeons, anesthesiologists, and nurses, like really need to communicate with each other for everything. So, and we all know that communication in healthcare is very important.
Yeah, they say that, I mean, there's a lot of sort of hand waving arguments. They say that 70% of medical errors are due to poor communication. I would say it's very high. I don't know if that number is completely accurate. The other thing is on checklists, there is a ton written on checklists and surgical checklists. The literature is all over the place. So some people say it's great and it's wonderful. And then they did an independent study that was published in the New England Journal of Medicine. This must have been 5 or 6 years ago. And they adopted a surgical checklist, and it showed no improvement in surgical outcomes or reduction of errors. And somebody did a drill down analysis of why in the past they've been shown to be very helpful, and in that particular circumstance where they were, you know, where they tried to implement them in Canada, they were not successful. And the overwhelming cause of it was that the way they implemented it, there was no buy-in. Remember, you know the way I teach, experiential learning, solve the problem yourself, own it. So they just imposed it. There was no experiential learning. There was no buy-in. There was no people coming up with their own solutions, so they owned it. And of course, it just failed miserably, and because they wouldn't use it. They were like, yeah, I'm not doing this. I don't need to do this. I know my patient. I know that I'm operating on the left or the right. But these never events happen all the time. And so I wouldn't spend a ton of time on it because the literature is all over the place on it. But I think coming up with best practices and a recommended protocol for wrong level surgery would be very interesting and extremely useful. So if you come across, and I think there are actual experts, and a detailed Google search will find you stuff on wrong level surgery, but you'll tell me over the course of the next couple of weeks. So that's great.
Yeah.
And your topic, what topic did you tell me your topic already? Not topic for your paper, the Kaiser Health News, anything of interest?
I saw from yesterday's that the state of California isn't requiring COVID vaccines for kids to attend school, which I thought was super interesting, because I feel like there's been, since like the holidays and stuff, there's been some like spikes in cases. Like one of my good friends goes to UNH, and 3 out of her 5 professors have COVID. So I was like, okay, so why won't they should be requiring kids to get vaccines for schooling, which I understand in the circumstance of like medically you can't, but I just feel like they need to more promote like vaccine work, especially with COVID, than like
with the like little kids so they can be like immune to it and all that stuff. So
Yeah, no, interesting dilemma. I mean, we've got places all over the place just going back and forth, wear masks, don't wear masks, there's vaccinations. The true number of times that there's a bona fide medical contraindication to vaccination, it's as rare as hen's teeth. It just like never happens unless you've had some other vaccine, you have some hugely horrible allergic diathesis, like you've got asthma and a million different allergies to foods and bees and a ton of other things, which some people do have. But overwhelmingly the medical exemptions. But if you read the news, they're allowing tons more medical exemptions, which they haven't, which at one point they were cracking down on, and religious exemptions. And I don't know how you provide proof of a bona fide religious exemption. So that it raises all sorts of problems. But I don't know. I went out shopping on Monday, and I don't think 1 in 50 people, I was wearing my mask, but I don't think 1 in 50 people grocery shopping, 1 in 50 people was wearing a mask out there. So I think we're in a psychological state that this is over, and we're just going to keep going on. And the 3 professors who got COVID, that's current. That's in the past month or past few weeks.
it's current.
Oh, let's hear it for Zoom. Yeah, you guys can cough all you want. I don't mind. You don't have, and you don't have to wear a mask. So yeah, no, that's interesting. Kelsey,
Hello.
greetings.
So for my paper, I didn't get to like tell you anything last time because I was having some difficulties.
Oh yeah,
Um,
did you get to see the recording, or did you want to see the recording?
Yeah, if you could send that to me, I can rewatch it. I
It's
stayed
on my-
in for like I could hear you.
Yeah,
I
and then
just
I saw
couldn't,
that you just bowed
yeah.
out. Yeah, no, it's all good. Technical stuff happens. It'll happen to me at
I
some
like
point.
one point I just like lost connection, so I was
Yeah,
like,
No
okay,
worries.
so
No worries. We
I'd
can't.
love to review like the end of it. I think
It's-
I was in for at least 45 minutes, but I'd like to see like what was discussed in the rest so I can be up on that.
Yeah, you're free to do so. It's on my YouTube channel, so you've got my email. You can just click on my YouTube channel. That's where I post it. I can send it to you individually as well.
Okay, sounds good. I can check on the YouTube channel.
Yeah, so it's
Oh.
just our lectures and a couple little things of my own. So no worries.
Okay, sounds good. So I know the other class when I could speak, I was talking about doing deaths of children related to motor vehicle injuries. I've since changed it to deaths of children due to firearm incidents because that's more present. So I started looking at like the causes and like why it has increased and like found like just like a couple articles on like that so far.
So I don't know if I send it to you, but there was a recent article, and you should be able to find it with a relatively short Google, going over the breakdown of the ages. And I think we talked about this in class briefly, that the breakdown of the ages for firearm related deaths is overwhelmingly minority and resource poor communities with gangs and the use of guns. As a matter of fact, there was some kid who was just recently rearrested or incarcerated for killing a 15-year-old, and it was a targeted killing. I think it was in Boston, and this is his second arrest for murder. He murdered somebody when he was 13. So these are all, and since he was targeted, clearly we know it's some kind of a gang-related thing, almost certainly. But it's just really sad. So it'd be interesting because the interventions for gangs are completely different than the loaded firearm that's left in the, in a drawer on the table, the bedside table. So I think it'll make it more interesting to say in this age group, we need to work on gangs and preventative measures. And in this age group, we need to require firearm locks or whatever you think is best. You're going to research it. You'll know it a lot better than I will.
Yeah,
by the
I
time-
wanted to look into like I could even find it more like down to like an age group, but I
Yeah,
need to
no,
look
no,
into the
absolutely. Do whatever,
research
yeah,
there.
do whatever, yeah, do whatever you want. I encourage you to make it easier on yourself. If you
Okay.
if you keep hearing me say narrow your topic, narrow your topic, narrow your topic, it's only because it makes it easier for you. I mean, you're generally not going to sit there going, oh my gosh, I could only write 4 pages on this. It's usually I could write 40 pages on this. I wish I had a narrower topic. And I think that's uniformly true because
Yeah.
lots of these areas, have been studied for years. And anything in Kaiser Health News, or did you already say it and I forgot already?
One of the things I was like sort of looking at was like the telehealth versus no care. So like basically the government like leased out a thing to doctors' offices and like mental health services that they were allowed to hold meetings on like telehealth online over the phone, like because the waits ended up getting so long and so overwhelming. Now it's like reported that they that like period of time is like coming to like an end, so like some people are like trying to get them to like continue it so that like more people can be seen and like stuff like that, but they're like trying to like eradicate online appointments again.
So why do you think that's a good idea to eradicate online appointments, or should we maintain them?
I mean, I think that they're good. Like, I personally use them. It's so much more convenient, especially when like being up here and not able to go home to an appointment. But like, I get like the like security risks they're like trying to like prevent with it. Like, they don't want anyone like to be able to hack into it. And like, I like get that it's like a confidentiality thing, but there's like also like a confidentiality risk of doing it in person too. Like there is no real like straightforward answer.
Yeah, I mean, this gets to our discussions previously about HIPAA, thousands of pages of rules and regulations and statutes, all when there's like, I don't care if somebody, knows that I went in because I had a cough or a runny nose or a flare up of my gout. And you're absolutely right. The in-person, a lot of times they like announce your name when you're getting called in, which is supposed to be verboten as well. When they're going out into the waiting room. I'll just be curious, what percentage of healthcare visits do you think are amenable to telemedicine? So just give me your guess, 10%, 20%, 30%, 40%, 50%, 60%, 70%, it's way over 50%. 80% of visits are follow-ups. And almost everything can be done via telemedicine. You can have people just, you can take a look, oh, look at my throat, and put a flashlight. There's add-ons to your phone where it's literally just a scope, and you can put it in your throat, you can put it in your ear. Hopefully nowhere else. Please save the gastroenterologists, their profession. But there's just so many opportunities for doing telehealth, and literally millions and millions of hours are I mean, unless you love sitting in a waiting room, but there's so many infections that would be saved. So you don't sit in a waiting room with other people coughing and sneezing on you. And the whole concept of, the doctor's 2 hours behind, why am I sitting here burning gas, sitting in this waiting room, exposed to all the other people in the room, when I can just be sitting in the comfort of my home, and you can notify me when the doctor's free. So I'm not wasting my time. Or I can be doing my homework for school while I'm waiting for the doctor to log me onto the Zoom appointment. So yeah, no, I think it's a great technique. I think, do people think it should be paid the same way, that you should get the same amount as a healthcare provider for a telemedicine visit versus an in-person? How many people think you should get the same amount? How many think you should get more? How many think you should get less? Yeah, it was kind of split evenly. I would suggest, okay, I'll make it an easier question then. Do you think it's more expensive to provide a telehealth visit or less expensive? And I'll give you a scenario so you can really calculate it. Let's say you take half your practice and make it telehealth and telemedicine. Is it more expensive or less expensive of you to deliver that care if half your appointments are telemedicine?
It's less expensive because you're not those are like cases where like you're not wasting resources, having to use supplies to like change out the patient rooms, clean it, sanitize it, all that. So it's like saving you money. And if you like also had like something that was fully an online thing, you wouldn't have to be paying rent on a building. You wouldn't have to be like doing all that stuff.
Yeah, no, you're that's just 100%. That's exactly right. And there are entire industries that are, you know, being bought out by, I think CVS has now bought out one medical and then another gigantic primary care. And almost all this is provided via telemedicine. And of course, you don't need, just what you said, Kelsey, you don't need an office. You don't need somebody to answer your phone. You may still need some billing, but a fraction of what you would otherwise need. Your back office would be reduced in half. And so, and you know, you don't have to have whoever's normally taking your blood pressures, you tell the patient, you know, spend 15 or 20 bucks, get a home blood pressure monitor, you can take your own temperature. So there's so much that you save in terms of telemedicine. Now, as you can probably imagine, doctors are fighting up, down, and sideways to try to get paid the same as an in-person visit. It just completely counterintuitive. All that does is enrich the companies that do exclusive telemedicine because they have a fraction of the overhead. The doctors are literally, they don't realize this, but they're putting themselves out of business. There should be a market rate for a telemedicine visit, and it should be for those companies that do, you know, something hybrid or more telemedicine. And for behavioral health, it's fantastic because there is nobody to provide behavioral health, and telemedicine is just a phenomenal solution for that because you're not taking blood pressures or looking down people's throats. You're carrying on a conversation, and providing counseling. So that's good stuff. Amisa.
You skipped me. Do you want me to go?
Oh, did I? Oh, yeah, I did skip you. Sorry about that.
No worries.
Yeah, go. I mean, it doesn't make, I mean, just at the end of this, I'm going to ask, you know, who didn't speak, who I missed. So yeah, might as well start now because I missed you. Sorry.
Okay. So my topic in Kaiser Health News that I found interesting was about, you know, they were talking about like the vaccine for RSV for infants and how a technicality could keep it from low-income infants. Well, I started reading the article and it's, you know, it's because it's not technically a vaccine, it's a monoclonal antibody. So I found that interesting and how, you know, technically the way that the law is written, that's not included, but it could save so many infants' lives from RSV.
It's particularly lethal to infants and newborns.
And then for my paper, I'm doing it on you know, IVF, you know, what happens with IVF in states where abortion is illegal. And so I was reading this article today on it was like an employer law firm website, and it was talking about the different repercussions that could have effects on the workplace because of these laws, such as, you know, employees moving to other states, like you know, having high turnovers in states where it's illegal, if that's part of their family planning. And then also I found this really interesting. It was talking about how South Carolina and Alabama have specific exemptions for IVF in their abortion laws. But I've searched everywhere and I've read the South Carolina law. I haven't done enough on Alabama yet, but I can't find a single spot where it says that in the Alabama or in the South Carolina law. So I'm trying to figure out what they're talking about. And if it exists in the Alabama law, then I want to know what the wordage is that they make it fine, like, and that's, you know, patients and clinics aren't going to be held reliable later.
Yeah, keep me updated. It's all interesting, and you might find some interesting approaches internationally. I think Italy has some prohibitions, but yeah, you're going to find, again, it's going to be a state by state decision. But I think the point you make about changing your job and moving to a different state, you know, IVF does not lend itself to, oh, every Tuesday I'll drive 600 miles to have my ovaries checked for, or, you know, I have to go for a procedure to have, you know, for follicles, counting follicles or harvesting follicles. And, you know, it requires pretty much daily injections, which are typically self-administered or administered by the spouse, but it's a labor intensive and not amenable to, you know, process that's really not amenable to, you know, driving hundreds and hundreds of miles to a state that allows it. So it'll be interesting to see, you know, what you see as sort of best practices or something that can work. And the RSV thing, hopefully they'll just change the language so that it's provided, even if it's not technically a vaccine. How long does it last? If it should last for a relatively short period of time. Is it a monoclonal that's given a yearly? I remember reading the article, but I didn't click on it. I just read the one paragraph. I can look it up. It's
I didn't see, like, I read the majority of the article itself, and I didn't see where it said that it lasts for a certain amount of time, but maybe I just missed it.
Yeah, no, I mean, it's just if it's not invoking, I mean, my understanding of monoclonal antibodies is they circulate for a certain amount of time, but if it's not stimulating the immune system, then it's got to be time limited until they're gone. But I really don't know. It's not my area of expertise. The one thing I do know is that previous attempts to create a true vaccine for RSV have actually backfired, and the kids who got the vaccine got worse, not better, than people who didn't get the vaccine when they were exposed to RSV, because there can be this inflammatory response if the vaccine's not properly compiled, or the body just reacts in a strange way to it. So
well, it
interesting
seems
program.
like the from what I was reading, it seems like the one for children above a year old was effective, and that one is about to be approved.
Yeah, the one that I say blew up was 5 or 6 years ago. I think it came out of Texas, and it was just a disaster. It's not germane. I'll just educate myself, because it is an interesting topic. And again, they can just change if it works and the FDA approves it, they can just change the language to say vaccines and, so hopefully that would just be an easy either regulatory fix or a statutory fix. So interesting. Amisa.
My paper topic is inmate worker safety. I found recently that while it's not surprising that inmates are allowed to form unions, they don't have a right to form unions, which is kind of like not surprising. And also kind of like it's a right to form unions, and I just wasn't surprised, but it's also it's something new I learned. And for my
small businesses are not typically allowed. I mean, they're very strict criteria for what kind of businesses are allowed to try to put a union out there. So I would say over 50%. You can educate me about it, but I think it's close to 50% just by virtue of their size. They don't have enough employees. Don't allow unionization. So if it's a federal law, typically they have it has to comply with interstate commerce, and they typically say, you need either 15 or 20 or 25 employees, and the vast majority of businesses have less than that. So that's why you don't hear about unions and stuff with small businesses.
Well, in prison, so it's like.
Yeah, I mean, prisoners are stripped of almost all their rights. It's beyond scary. I mean, there are many states where you're not allowed to vote if you're an incarcerated criminal. I mean, the list just goes on and on and on. I'm trying to remember if it's California. There was something in Kaiser Health News that they said you're excluded from Medicaid as a prisoner, which is California. It's bizarre, especially with a progressive state like California. But the problem is by common law, prisoners have to get basic medical care. You can't just say, oh, you've got appendicitis, you're a prisoner, we don't care, you die of appendicitis or sepsis or whatever it is. So it just seemed like a completely bizarre rule coming from a state that's supposed to be progressive. So yeah, it'll be interesting to see. And then again, just looking forward to hearing from you as to what are best practices and how do you protect the rights and the safety of those who are incarcerated. And any topic in Kaiser Health News?
From last Friday, I found that something about the immigrant staffing of care facilities. So they explained the story of a woman who was granted political asylum, and rather than she came here with no job and no family and stuff like that. But she was able to get certified as some type of care aid, and just, I don't know, just initiatives like that. I feel like more initiatives like that, and equipping people who come to this country with low economic status, small things like that like make the world a difference, like providing programs like that.
I'm trying to remember what federal department just proposed dramatically increasing and facilitating people sponsoring people who are in the country and don't have the ability to do work. And I thought that was a great idea. If the government's not going to do it, let the private sector do it, and get people who, and churches and just do good groups, nonprofits to kick in and get help. So yeah, no, I think it's a great initiative. Amy.
So my topic is like the baby formula crisis, kind of like preventing it. And I saw that the FDA, the Food Safety Modernization Act, requires the agency to like inspect domestic food facilities at least once every 3 to 5 years. But the FDA has a policy of annually inspecting infant formula manufacturers, because it's like the sole source of nutrition for some like vulnerable customers.
Yeah, no, it totally makes sense. There are certain categories of food that are much more important. Like, if it's candy, it's a disaster if something bad happens during, for kids or during Halloween or something. But, it's not like anybody's starving to death. It's just contaminated food. But for infant formula, I agree with you. It's a unique problem. So, and I wonder what other food types would fall into that category. It's hard for me to think of any off the top of my head, but definitely an interesting topic. Anything in Kaiser Health News?
I saw something that was like, I think it's by 2029 to have like less sugar and more whole grains in school meals, like reducing sodium in school by 30%.
Added sugar is also a huge one. I remember I did see the article as well, and added sugar is like considered anathema. So getting rid of cookies and brownies and cakes with frosting and anything that has donuts, anything that has tons of added sugar is considered detrimental, and is getting you away from minimally processed foods and sticking to a more healthful diet. So yeah, no, I think that's crucial, and we should start kids on that early on. And again, as we've talked about before, you're fighting the food industry that's trying to get kids at the earliest age possible addicted to cereals that are loaded with sugar and totally unhealthy and highly addictive, and junk foods and lots of sugar added drinks and juices. So yeah, it's a disaster, and it's an uphill battle. So interesting. Madeline.
So my paper topic is on PFAS. I was doing it on cookware, but I found some pretty interesting articles and stuff on like the water pollution and stuff that PFAS is in. And last class you mentioned like comparing it to like other like states and countries and stuff. For the United States, Michigan has like the highest levels, and then a lot of countries in Europe also have. So I'm wondering if I should change my topic slightly to like the water pollution.
Yeah, sure. Whatever's a bigger, I would choose whatever topic's a bigger health impact. And I'm guessing that water, because, certain segments of the population have, a non-stick cookware, but water is universal and required, and it'd be really interesting to just compare both states and countries in terms of what they consider best practices and what the science shows about how detrimental they are. Yeah, so that's good. And anything in Kaiser Health News?
Yeah, I'm pulling it up on my phone because I
no
had
worries.
it, and then but it more money for like mental health like programs and stuff. So like a lot of states are realizing, especially after COVID, how important mental health is, and so a lot of states are pushing to get more money to have programs to help with mental health.
Yeah, can you think of anything preventative as opposed to throwing money at the problem and getting more counselors and psychiatrists and psychologists and social workers involved?
I mean, I feel like
that whole upstream concept that we've talked about.
Yeah,
What
I
would
mean,
be
I
an
feel like
upstream consequence?
knowing, like finding ways to like prevent yourself. So like don't like I keep myself busy. Like I always have like things to do. So I don't have like time to like think and stuff. Which is not really like the healthiest way, but I like it works for me and like finding different ways to.
Yeah, so keeping people, and this is just the whole social determinants of health and zip codes more important than genetic code. I mean, you know, raising the level of access to good, you know, health literacy, resources so you can have healthy food, outdoor, in a healthy, clean outdoor environment and social interaction, all of those things, healthy families, reducing poverty and helping the resource poor is definitely going to significantly help in terms of mental health and dysfunctionality, depression, etc. So yeah, so that would be an upstream approach as opposed to spending more money to hire psychologists and psychiatrists. But again, typically the monies are used for sick care as opposed to prevention and wellness. So yeah, no, definitely a crucial topic. And last but not least, Monica.
Yeah, so my paper topic is healthcare financing between comparing America and Switzerland. Something interesting I found about how I'm doing just background. I'm trying to find background information on healthcare in Switzerland. And so apparently Switzerland has a decentralized healthcare, which when I think of like developed country, most of the developed country has like a centralized healthcare system. And so where 26 cantons, which is like 26 states, I guess you can call it, have different, they individually have like central control over like which healthcare is in their state. And so I was thinking how that would be if America adopts that, how that would play out in the United States. I don't think it would be the best, to be honest, if that's the
Yeah, so
case.
Germany has a similar system, and I think even Canada does, where each province sort of has its own budget and manages within it. You know, sort of there are pros and cons to tailoring to specific areas, which is supposed to be the American way. You know, states come up with their own solutions. Whatever state comes up with the best one, other states can copy, versus centralized control. And does that meet the needs? I mean, is a healthcare system that's designed for, you know, Massachusetts good for a healthcare system like in Wyoming or Montana, where it's a very different population base and spread out? So I don't have a right answer on that, but it'll be curious to see what the arguments are back and forth and what authority they give to the regions. I think Germany has like 8 or 12 or something, but it's an age-old problem of centralized versus distributed management and oversight. And a lot of times you own it more if it's yours to own, meaning it's your region, it's your budget, it's your, your decision making.
I think like basic healthcare still should be the same, because if you give it up to the states whether or not to provide healthcare and how much healthcare coverage should its state provide, I think this whole debate is going to go like, the whole thing is going to go against Republican and Democrat states. So, and that would be bad, I feel like, because America is so divided.
Yeah,
but,
no, so I totally agree with the statement, essential health benefits, that there should be a core bit of essential health benefits that are included within comprehensive health care. And Obamacare tried to do that, and they did it nationally. And so every state had to comply with that, but they didn't have to comply with it when it came to Medicaid, which is more state oriented. So, and the benefits are all over the place depending on what state you're in. So there should be just some kind of happy medium for coming up with what are core essential health benefits, and then from there, and then the financing might be done on a regional basis, but your essential health benefits, I agree with you completely, should be set in stone. So we got through it all. I'll give you 5 minutes. We can start just after somewhere between 12:55 and 12:57. That gives you 5 minutes. And I will just say to you briefly that next week, next week, you're going to be asked to sort of give some feedback. If you want to give it anonymously, that's fine, just to say how we can make this interaction better. I think this is great. I like this. We spent half the class getting up to speed, talking about current topics, and then we'll focus on what this week's about. If you think there's a better way to do it, or there's other topics, or you want to make it more topics and less time spent on this, that's fine too. I don't have any, ownership on it. I just want it to be a good experience and a class that you look forward to logging into. So yeah, just give whatever feedback, and if you want to fill out the form, that's fine. That's not as important to me. If you just want to give me a narrative, that's fine too. So and again, this is all just an effort to improve, and make it better for everybody. And I'm happy to share the results with people. So, because half the people say, half the people want it one way, or it's divided up in the class. So I just try to keep everybody a little bit happy and everybody a little bit disappointed, which means that we came up with a fair compromise. So I'll see you in about 5 minutes then. I'm just going to start up again and let people trickle back into the room. We can go over the questions. We'll just go over the questions because that would just make it that much easier for you to fill in your assignment, and whatever we don't cover today, hopefully all the questions will be done. And then we can talk about general sort of the EPA issues that you were assigned to go over, and then global warming as a topic. So the first question, other than what we already went over for the perception class, is number 3: how important is air pollution in causing disease? And that in the United States and worldwide. We can talk worldwide as well. I mean, let me just give you some numbers, and you guys can guess by just raising your hand. So so how many people a year worldwide die due to air pollution? And of course, these numbers are all over the place, but there's a pretty firm range. So 500,000 or less, 1 million or less, 2 million or less, 5 million or less, 10 million or less. So the current, when you look it up in the World Health Organization and different organizations that talk about it, it's around, they say it's somewhere around 6 million, and some countries are infinitely worse than others, with, just basically clouds of dust and pollution in urban settings in particular, or where there's industrial urban settings. It can be really bad. And, but tons of people are injured and end up with long-term health problems, even just associated with chronic exposure to smoke, associated with wildfires, associated with campfires. I mean, for a while there, worldwide campfires were a huge source of pollution because, in third world nations, where they use open fires typically for staying warm. And anybody who's camped or been around a campfire can attest to the fact that if you're downwind from the campfire, it's not a pleasant experience, whether it be your coughing and hacking, or your clothing, or all the singes and holes from the sparks going out there. So yeah, it's a huge problem. What would sort of be other major pollution things that would cause deaths?
In my questions, I wrote about the burn pits and all like the cancers that the burn pits cause.
Yeah, so there are Superfund sites with bearing of toxic chemicals. There's burn pits. Is water a problem in terms of pollution? And what's the biggest problem in terms of pollution with water that kills hundreds of thousands, if not millions of people? It's sort of indirectly a water problem.
Is it malnutrition or like dehydration?
So yeah, but what causes the dehydration?
No water.
People aren't dying from thirst. I mean, they may have not great availability of water, but I haven't heard of people dying of thirst. But what causes dehydration that's associated with contaminated water?
Isn't it
disease? Sorry, you can go, Jenny.
I was gonna say, isn't there like different like bacteria and fungi in water that can affect it?
Home run. Dysentery, Shigella, Salmonella, Vibrio cholera. Hundreds of thousands of people die every day of these, and it's indirectly a water problem. It's actually a sewage problem. People don't have adequate sewage, so they're defecating and shedding, billions of these of bacteria and viruses into the water, and then the water is consumed and not adequately cleansed. So yeah, water and air are gigantic contributors to poor health and mortality, frankly, associated with environmental contamination. Oh, and that was my second question. 4 is water important, water pollution causing disease. So what's the hot topic in terms of water pollution in the United States that we don't have as much a problem with dysentery and Vibrio cholera? I mean, those are typically resource poor countries that are struggling with that much more so than we are. But what's been a recent contaminant in water that's created a furor?
I think chemicals like PFAS. I think Maddie's doing PFAS.
Sure. What happened in Flint? Does anybody want to Google that quickly, or do they?
Is it lead?
Yeah, it's lead. And what's the source of the lead?
The pipes, and I mean, there's some in old paint too, but it's not really pertaining to water.
Well, no, interestingly, the first problem in Flint was they changed where they were drawing the water from, and they went from a cleaner source to a much more contaminated source. And they didn't tell anybody, and people, they tried to criminally prosecute people. But then on top of it, they have super old lead pipes, and the lead leaches into the water. Who does that disproportionately involve, if any of you know what the toxicity of lead is?
Children.
Yeah, it's devastating to children. And what is the manifestation of lead toxicity in children? Anybody?
Like the symptoms of it, or
the symptoms. How do you test for lead poisoning in kids? How would you first recognize that it's even a problem?
There's a variety of symptoms, including like seizures, and but first, isn't it like concentration and stuff like that?
It's all CNS. It's really horrible, and a lot of it's not reversible. So when I say CNS, central nervous system, brain dysfunction, and it's just, and it again, can you imagine anything worse than kids getting brain injury from lead in their water that you can't taste, you're not aware of it, and the city's aware of it and doing nothing about it. I mean, at least and you can boil water all you want, that just makes it worse. You concentrate the lead in the water. So your only option then is just bottled water, and making sure you're not consuming anything from the pipes. So is this an easy fix or a hard fix?
Well, it's more like the cities have to implement and states have to implement, like talking to like landlords and like other building owners to fix this problem, because
So is it the
more,
state's problem or the building owner's problem, or both?
well, I was gonna say it would be both,
Yeah, it's
because the state
overwhelmingly-
needs to
yeah,
implement these programs,
Yeah,
and the landlords should be able to follow the guidelines.
right. So it's overwhelmingly greater than 100-year-old city, state, and public pipelines that are leaching the lead in. If you have a home that's built in 1980 or afterwards, the amount of lead that's going to be in those pipes and leaching out is minimal. But if your entire community has 100-year-old water pipes, it's a gigantic problem. And is it easy to fix or hard to fix? In terms of cost, logistics, etc.
I imagine it's a difficult fix.
Oh my God, it's horrible. I mean, you got to dig up literally thousands, if not tens of thousands of miles of pipes and replace them. So it's hugely expensive. And, if you say to people, who's going to pay for this? This is the problem. I mean, right now we're operating at the world's largest deficit. We're hearing in the news every day about how they're not going to increase the the budget and the allowance for deficit, and it's all politics of the Biden saying it's non-negotiable, and the Republican House saying we're not even going to talk about it unless you're willing to negotiate it. And of course, they're two separate issues. Increasing the debt ceiling pays for debts that we've already incurred. Negotiating a new budget is negotiating a new budget. How they conflate the two, I have no idea. If anybody has some idea on why they conflate the two, it makes no difference. I mean, you have to pay the bills that you owe. We defaulted on our debt. And yes, do we need to decrease our spending? Yeah, we dramatically need to decrease our spending. And those are going to be all incredibly difficult decisions and will require lots of negotiation. But it's a really burgeoning problem that we will follow together over the course of the next 6 months. So the next two questions are about global warming. So let's just talk about global warming at the 10,000 foot view. Maybe I should say 60,000, because that's probably the level of the atmosphere that's most importantly. So anybody want to tell me what global warming is, whether it's real, what contributes to it? And a lot of this was in that 8-minute YouTube, which I thought was excellent. The first 4 minutes give you some background on it, and the last 4 minutes give you 10 solutions. Somebody who hasn't spoken. Your 15% of your grade is your participation. So please participate so you can get full credit. And when I say hasn't spoken, everybody spoke the first time because you're required to speak. I mean, since the second half of class, somebody who hasn't spoken.
I mean, I personally didn't know much about global warming. Like you hear all about it, like you've been taught it when you were younger, but I didn't really understand what it was. So that video was a quick little snippet of what it was. And then for the second half of the video, I was pretty interested how food waste played a big factor in global warming and stuff. That I found that pretty surprising and wasn't expected.
I couldn't agree with you more. I'm not shy to tell you that I've been hearing about global warming forever, but I've never sort of really looked into it in greater depth to understand it. Again, anybody who hasn't spoken for the second half of class, greenhouse gases. What are greenhouse gases and how important are they and what are they?
Isn't it the natural gases that are they're using to keep the greenhouse warm, and as they're doing that and it's going in, there's a vacuum system that pulls it out but doesn't let the outside air in, so it's just going into our atmosphere?
So it's and when they say greenhouse gases, it's not greenhouse like plants and growing things. It's greenhouse because the entire atmosphere becomes a greenhouse. So the entire planet is becoming a greenhouse. So anybody who hasn't spoken, want to tell me what those gases are? And what's the one we hear about the most, which is misleading because it's not the biggest problem?
Methane.
So methane is a very potent greenhouse gas, and it's 10 times more toxic to the environment in terms of causing global warming than what is the most commonly discussed one, which is
Carbon dioxide.
Yeah, carbon dioxide. So I was going to give you a hint and say exhale when you give me this answer. So where does that, pardon my bad jokes, by the way, you have to forgive me in advance. I get a smile out of maybe 2 out of the 12 of you, which is okay. So what's the problem? Where do people think most of the carbon dioxide is coming from, and what is promoted? Which again, I was unaware of till I did the background research for this class. When you think of carbon dioxide, what do you think about?
Is it the deforestation?
So that's your carbon sink. That's what gets rid. So it's a great answer. It's just it's the flip side of the coin. So carbon dioxide is removed from the atmosphere by trees and plants. They take carbon dioxide and use photosynthesis and create energy. So when you get rid of all these trees, which is a huge problem and is presented as one of the solutions, then you can't get rid of the CO2 that's in the atmosphere. But what would you say causes the most CO2?
Is it our energy production?
Yeah, so it's energy production. A lot of times people just say, oh, it's cars, it's our vehicles, it's airplanes, cars, buses, trains. What percentage of the greenhouse gas problem is related to that? I always thought it was like 70, 80%. If we just stopped driving our cars, it'd be solved. You get your choice here, 10%, 20%, 30%, 40%, 50%. So that you guys guessed exactly what I guessed. It's under 20%. If you go back and look at the YouTube, it actually highlights that, that there are many other sources of carbon dioxide and greenhouse gases. And I think Keisha mentioned methane, which some people say is the key to solving our problems. And where does methane come from?
Meat industry, a lot of animal farming.
Yeah, so pig farms with these slurries of pig feces, just pour methane, and same with beef, pour methane into the atmosphere. So, and there's no sort of ability to contain it, make it less toxic, change it from methane to something else, or just bottle it. I mean, bottling it, at least it could be used. It would contribute if we burn it to create energy. It would create CO2, but it would at least get rid of the methane, which is 10 times more toxic to the environment in terms of greenhouse gases. And then there's nitrous oxide or nitrous dioxide. There were a few others in there, and again, if you don't remember this, it's well worth the 6 minutes on Speed and a Half or 5 minutes on Speed and a Half to refresh your memory on it. But I thought it was just telling. And then just 1 second. I want to get to the solutions. He has 10 solutions after minute 5. So can anybody, and feel free to cheat and pull up the video and freeze it to look at it, for what the solutions that he proposes, the 10 solutions. And this is in gigatons of CO2 equivalents between 220 and 250. I can screen share if you want.
Sorry, you said any solution?
Yeah, there's 10 mentioned in this 5 minute or 8 minute. Yeah, but any of the 10 that he talks about.
The one I found most interesting was the health education one. Like I've never put together pregnancy and climate change. Like I never really put those two together.
I never would have guessed that. But of course, once he explains it, it does become somewhat intuitive. If you're aware of a problem, then you're going to do something to fix it. If people are unaware of it, then they're not going to do anything to fix it because they're unaware of it. I thought it was funny too that the first one that comes up for the greatest impact is reduce food waste. And that's why they talk about composting and that composting is so much healthier because it produces far less methane than throwing all your composted goods and organic matter into a plastic bag and burying it in a landfill when it becomes pure methane. So I thought that was fascinating. But anybody able to pull up the list, rattle off a few that surprised you?
I have it up. Do you want me to save the list?
I'm happy to read it as well. So number 3 is plant-rich diets. Number 4 is refrigerant management, which I thought is, again, really cool because all the stuff that we use for refrigerants is really just, creating a greenhouse effect. Tropical forest reforestation, onshore wind turbines. So frankly, using alternative energy sources will be immensely beneficial. And again, so offshore wind turbines is also then figures in with using solar power. And that's numbers 8 and 9, utility scale solar photovoltaics and distributed solar photovoltaics. So lots of stuff. And then another sort of tree planting in addition to reforestation. And so there's sort of 3 or 4 broad categories that are going to have an impact on this. So it's definitely it's kind of multifactorial, and then your prevention is also multidisciplinary and multiple approaches to get to the problem. let's go back to. Sorry. Questions. So is it real or is it fake? We just keep hearing Republicans saying it's not a big deal and other people saying it's an existential threat to humanity. Where is the truth in that? Where does it fall? Is there a consensus? Let's start with that question. And again, somebody who has not spoken in the second half of class, is there a consensus on the reality or the fakeness of global warming?
It's like a common debate about whether or not it's real. And like, I personally think you just like look at the scientific facts of it. And like over the past 40 years, like the core temperature of the earth has increased by like a degree every year. So like, that's what the definition of global warming is. And I don't know how you say it's not real.
Yeah, there's a huge, I was almost going to give it to you, but it was too funny and too many F-bombs in it. It was is it Jon Stewart, the guy who does the little blurbs, the comedian? I think it's Jon Stewart. Anyway, he was doing this whole global debate on this and was indicating, how this is, there's no debate on this. The two people get up and say that, it's not real and it's not related to what we're doing as human beings and it's exaggerated. And then they typically have one or two other people who say, no, it's real in the debate. But he said the way the debate should really be done is 200 people who say it's real should debate against 2 people, because it's about 99% of the scientists believe that it's as real can be and it has to be addressed. So, there is no debate on this. I mean, there is a debate. You get a fringe few, rare as hen's teeth, who say it's not an issue. And then the overwhelming consensus of the scientific community is clearly states that this is an enormous problem. And then again, the nature of the global warming and we haven't even talked about sea level rise, but they're saying literally that equatorial countries will no longer be inhabitable within 50 years. It'll just be too hot to support plant life and to support human life. And again, for every degree it gets warmer, you're expending more energy for air conditioning. And people talk about huge migrations north. We're in a good place for that. But it's pretty scary. I mean, the only thing that's comforting about being 63 is I'll be dead before it really gets bad. But you guys will be in a disaster situation. So we globally, the people in power and people my age and the younger people need to be working together. And why don't you think we're able to come up with a solution? Get people who are elected into office to come up with a 10 and 20 and a 30-year plan.
Well, I mean, here in the US, it's so like split based on your political party. And because that's like constantly like changing and like how many Democrats, how many Republicans are like in office at the time, it's like we get maybe 3 years down the process, but then somebody new takes over office and we're back at ground zero again.
Yeah, so you bring up an excellent point. It's a point I make as well. And I talk about it a bit in my blog in terms of term limits and the ability of a government that's structured such as ours to make decisions that are good 10 or 20 or 30 years down the line. In terms of politicians being popular, do they care if they're popular in 10 years or 20 years or 30 years? Or do they care if they're popular in 1 year or 2 years or 3 years or 6 years? What's the major goal of politicians? I'm talking about the United States now exclusively.
Well, they care about re-election. So
Yeah,
if they can get their original party behind them, then
yeah.
they're
So
fine.
all they care about re-election. So they have to keep whoever's electing them happy in the House. How often? Every year, 2 years, 3 years? The House is elected every 2 years. Every member of the House is re-elected every 2 years. So they spend half their time raising money for getting reelected. And literally, why would you make a decision that's unpopular with voters who need to reelect you in 2 years? Especially who are some of the most ardent voters, people participate in the electoral process, the young or the old?
The old people.
Yeah, overwhelmingly people with gray hair like me, which means you heard what I said. I'll be dead. I want to solve the problem, but I'll be dead. And you know what most people think about? Well, I don't want to raise my taxes, and I don't want to. I'm only here for another 20 years. Let kick it down the road. So we have a political system that kicks every long-term solution down the road. And frankly, we would do so much better. What's a political solution so that people will make better long-term decisions? What would you do to our political system so that people wouldn't be caring about, 2 years or 4 years or 6 years? And of course, I mentioned 6 years because the Senate turns over, a third of the Senate every 6 years turns over. So every 2 years, a third of the Senate is re-elected.
I was gonna say lessen the focus on money, like prevent people from spending more than X amount of their time on fundraising campaigns.
So that'll make them think about the issues more. But if you're getting reelected every 2 years, your motivation is to keep people happy for 2 years. So how do we get them to be less focused on what a good decision is for 2 years down the line? I'm going to give you a hint. It's I'm trying to think if I can do it. Yeah, I'll just tell you, term limits. If people are term limited out, you always hear about this. Oh, this person's not running for re-election. They're going to vote for what they think the right answer is, as opposed to what's politically expedient. And I'm sure you've heard that. Like, this person's not running for election. They may go against their party because there's no ramifications. But there's been debates back and forth, and I'm just the biggest fan of term limits, because without term limits, nobody's going to make the right decision for future generations. They're always going to make the right decision for how they get reelected. And term limits eliminate the whole thing. And how you create the term limits is completely separate. But as a public health issue, and a public health advocate who's trying to get long-term decisions made, term limits are just a superb idea. That and campaign finance reform, where big corporations that are just driven by money are making decisions. So the last two questions. Question 7, is the private sector effective in preventing pollution? Should this be a governmental function? Do we need statutes, or won't the marketplace take care of it?
My guess was that private sector was like much more tailored and like specific, and they had like more funding for research and like sustainability alternatives, but also I feel like private sector might be limited in that they like have less like collaboration that like being public sector might provide, if that makes sense.
Well, generally, keeping pollution down and scrubbing smokestacks and all that stuff is not inexpensive. It's very expensive for the most part to keep things clean. There are very few opportunities where keeping things clean is inexpensive. So typically, whether you're, either scrubbing smokestacks or recapturing carbon dioxide is not inexpensive. And corporations, like politicians, are interested in their revenues and their profitability, especially for publicly traded companies, for the next quarter or the next half, not for 10 years down the line. So they can give dividends and watch their stock go up. So, and again, a company whose toxic, whatever it be, water, plumes, chemicals, or air pollution, is blowing downwind to another state, affecting their population, if they're not that motivated to do it. So that's why the EPA exists, to put some measure of what's a balanced and reasonable societal solution, rather than what's going to keep your stock or your company profitable. So it's definitely a sector. I'm no fan of big government, but there are certain areas in the government that the government really needs to intervene, because the private sector has little incentive whatsoever to do the right thing. They're uniformly trying to maximize profits, as evidenced by our discussions in the food industry and the healthcare industry, for that matter. So it's good to get the government involved in that. And then the last question: what is the role of the EPA and the significance of the Pollution Prevention Act? And hang on. I'm pulling up the summary of the Pollution Prevention Act, and then I referred you to the US Environmental Protection Agency main website. And there's a list of key topics in there on the first page of the EPA website. So air quality, we talked about it. Number 2 on the list, you may find this funny, bed bugs. I still have no idea why people are so focused on bed bugs. I'm unaware of any significant disease, morbidity, or mortality associated with bed bugs, other than feeling, anxious about the fact that they're critters all over you, but they don't really cause any harm. Now, brownfields, I don't know what that is, and somebody can, I could click on it, but I'm not going to. Children's health, sure. Climate change, big. Coronavirus, fine. Drinking water, we've talked about it. Emergencies, enforcement, so that's environmental emergencies and how they deal with them. Enforcement, again, just a logistical matter for the EPA. Environmental justice, then lead, and we've already talked about it, and then Superfunds, which again, there are all these places all over the country where public monies go in because they've buried literally tons and tons of toxic chemicals, and the containers break down and it leaches into the water. And there's all sorts of places all over the country where it's leached into drinking water, causes cancer. I mean, it's just a disaster. So that's the Environmental Protection Agency. What's the difference between that and the Pollution Prevention Act? And it's a topic we brought up before. So, and you can see it under source reduction. It's right on the first page of the link I sent to you, and feel free to bring it up.
Can you repeat the question? Sorry, I missed it.
Sure. How is it different than I just described sort of the functioning of the EPA, but there's a separate piece of legislation that came in 1990 called the Pollution Prevention Act. And I'll give you the hint, it's the Pollution Prevention Act. So how is it different than typical enforcement things? So you see kids drowning in the river, do you row out to grab them and bring them into shore and send them to the ER? Or might you do something different? So we're literally from our first class, what are the different types of intervention in public health, and what are the different definitions of prevention?
So it's like more of an upstreamist approach.
Exactly.
To the whole climate change. They're looking at like recycling and that kind of stuff to stop it before it can get any worse.
Exactly. So that's just a preventative upstream statute that's sort of saying we better solve this problem before we have to clean up the mess. A super fund to clean up a mess of toxic chemicals is not a great solution if you can just keep the industries from using the toxic chemicals in the first place, and use less toxic or biodegradable means of doing whatever they're doing in their particular industries. So that's that. I kept all these things relatively short. We've answered all the questions. Next class on Thursday, we can dive a little deep, or do people want to do another topic? I mean, one of the topics I think is interesting, and almost everybody's expressed some interest in it. It sort of goes back to the malpractice and I'll just send out a handful of things for you guys to read about it. But criminalizing negligence, meaning, did anybody hear about I'm trying to remember if it was Duke, the nurse who was being criminally prosecuted for negligence that led to a patient's death, and it just created a huge uproar. And is criminal and incarceration of people trying to do their job because they make mistakes a good idea or a bad idea? The same thing is true for doctors, and the Supreme Court recently delved into a case where they were trying to incarcerate physicians who they said negligently prescribed huge numbers of narcotics, and these pill mills is what they're called. So should we be incarcerating nurses and doctors and healthcare providers for negligence?
I think that if we're going to incarcerate those nurses and doctors for negligence, we should also be prosecuting the corporations that put them in the position where they could be negligent. If a nurse should only have let's say 6 patients in his or her care, and they give them 12, I mean, it's unfortunate, but eventually a mistake is going to happen. It's not fair to that nurse. It's not fair to the patients that are in their care.
So the good news is, you know what, can somebody just look that up? I'm trying to remember if it was Duke. No, it wasn't. I think it was Vanderbilt. I'm trying to remember the name of the nurse. If somebody can put in nurse, criminal negligence, and Vanderbilt, then we can get her name. But it was a huge topic. But Keisha, you get your wish. It's called Respondeat Superior. I can send you a brief thing for the class to look at. And it basically means that every employer is fully legally liable for the errors and mistakes of their employee. And I think there was a huge outcry that Vanderbilt should have been on trial, not the nurse. Was anybody able to pull it up, what her name was and stuff? And I think it is Vanderbilt. Am I right or no?
Yes.
Yes.
You want me to say it? It's
Yeah,
Radonna
please.
Vaught, and then she was the former nurse at Vanderbilt University Medical Center.
Yeah, perfect. And what's her name again?
Radonna Vaught.
Yeah.
Yeah.
So anyway, every morning I wake up, my pillow's wet. It's because my brains are leaking out of my ear, but I remember enough tidbits so that I can Google it and get it all back. So I pour it back in the other ear with a Google search and with your help. So
Are you for real, or is that a joke?
what do you mean, that my brains are leaking out my ear?
Yeah.
Can't you
Yeah.
tell my head gets narrower every time we?
No.
So I ascribe it to drool and dementia, not my brains leaking out, but I'm pretty convinced there's some brains leaking out as well. So anyway, it's a really interesting topic, and there's good arguments on both sides. So is that something you want to talk about at the next class? I mean, we're going to spend half the class doing our usual what is of interest to you. Do people want to spend the same amount of time on update on your paper and Kaiser Health News, or less time, or it's fine the way it is?
I personally think if we do like update our paper once a week, maybe. Because
Okay,
I
well-
don't really change a lot throughout the 2 days I'm not in class.
More than fair. So we can do, and do people relatively agree with that? Because I agree with it, frankly. Unless you're doing a bunch of work between Tuesday and Thursday. Okay, so that's perfect. So you'll update your paper on Tuesdays, and then Thursdays we'll do Kaiser Health News, and then and talk about. Now, do you want to spend a half hour on Kaiser Health News or 15 minutes? Is there a consensus? Anybody can speak up, and then I'll watch whether people nod or not. 15 minutes, 30 minutes.
I think it depends on the topics we talk about, because sometimes there's some really interesting ones that people talk about, and I'm like, oh, tell me about it.
Yeah, no, I agree with you. I find this stuff phenomenal. I just think there's so many things that catch my interest, and then I click on it and read some more to educate myself. And then some of them are actually funny, so you can get a good laugh out of it. One of the funny ones that came out today was in Kaiser Health News was that an 82-year-old was pronounced dead at a nursing home. She was brought to a funeral home and found to still be alive. It just brought me back, and it's a true story, and it happens periodically. Once every 2 or 3 years you hear about stories like this. It just reminded me, you guys won't know what this is. Maybe I'll send it out to you, because it's a little bit humorous. Do you guys know what Monty Python is? Monty Python's Flying Circus. It's a British comedy show that was just crazy. I mean, just lunatic fringe, interesting cartoons. It used to be on PBS. So there's a skit that's done by these British comedians, and I can send you the link if it holds any interest to you, where there's a guy going out in a cart. This is supposed to be the Middle Ages during the plague, and he's screaming, "Bring out your dead! Bring out your dead!" And the cart's filled with these corpses and stuff. It's all humorous. It's not like, oh my God, that's shocking, that's horrible. It's all pure comedy. So one guy drags out a guy and he says, "This one's dead." And he goes, "I'm not dead yet." And he goes, "Yes, you are. You're dead. You're going to be dead soon." He goes, "I'm not dead yet. I'm getting better." And he goes, no. So it just reminded me of that skit. The skit's hysterical. I'll send it out just so you can get some grins and giggles out of it. But that's what I was thinking of. I'm not dead yet. Okay, great. We think we should send that skit out to the nursing home so they get it. So why don't we stick with, you know what? Let's do the topics of interest for Kaiser for as long as they seem. I'm not dead yet. Let's do the topics of interest for as long as it holds our interest. And if it's 30 minutes, great. If it's 15 minutes, great. And then we'll dive into it. And if you guys don't mind, I'll send out some stuff, unless you want to do the reading on your own on criminal negligence versus, conventional negligence. One's a tort, one they put the handcuffs on you and they put you behind, bars, and you lose your freedom. And one, you pay a fine, and it's civil damages. So big difference. And what's the right way to approach that? So do you guys want me to send out something brief on the topic? Put it this way, it's an elective. We'll talk about it next week. I'll make it more of a lecture so that I'll just be presenting the information for you. But if you're interested in it, I'll put another assignment in there with readings that may take 15 or 20 minutes, or maybe a half hour. I mean, a half hour between now and Thursday, I don't think is a big reach. Any questions, anything else that's going on? Perfect. And so I guess I will Zoom and meet with you all guys. And I'll be sending out that additional information, which if you get a chance to go through it, I think you'll find it interesting. And I'll make the discussion more interesting rather than just listening to me lecture. Perfect. Have a great day. Be safe.
Thank you.
Take care.